I think there's a tradition and legacy of neuroscience care at Valley Baptist.
Valley Baptist is the oldest and the most experienced comprehensive stroke center in the valley.
We're always at the front line, testing, pushing the envelope to make sure our patients get the most.
As you know, we do a lot of research, which would keep us on the cutting edge.
The majority of the studies we have performed here get published in great scientific journals and actually change the guidelines for stroke treatment. I'm very confident in our treatment here, and I know that if you come here with a stroke or a neurological disease, you will get the best treatment possible.
We have a more complete team. We have been together for a very long time. We have protocols in place to deal with all kinds of complex neurologic conditions.
I have family here. It's extremely important for me to be confident in my own hospital. And I know confidently that anybody who comes in is going to get the appropriate care, not get COVID while they're in the hospital, and be still treated appropriately for whatever disease they have, whether it be heart attack, stroke, or just COVID positive respiratory distress.
The risk of getting COVID while at the hospital is probably less than the risk that you take going to the grocery store. We've identified and separated COVID patients from non-COVID patients.
All patients coming into Valley Baptist are getting their temperature checks. They're getting questioned about their travel history, contact history. So everybody every single day is wearing a face mask, getting their temperature checks, and almost all patients, if not all, are getting COVID tested.
I think we take extra steps in the outpatient world as well when we're scheduling procedures by doing COVID testing. I think that's to provide reassurance not only to the patients themselves but also to the staff.
Stroke care is time sensitive. We want patients to come in so we can offer treatment in time. COVID-19 has two major impacts, a direct impact and an indirect impact. The indirect impact is on patients who do not have COVID-19 infection but are scared of coming to the hospital with other symptoms such as stroke, heart attack, and other diseases, and sitting home for fear of getting infection if they come to the hospital.
The faster you come in, the patients who come in within 0 to 3 hours are more likely to benefit. Come in immediately, because your body has collaterals, which means it has arteries that can help fill the other side that's clotted off. But they only last for a certain amount of time, and everyone is different. Nobody knows until you come in and get that advanced imaging. So with all of our advanced imaging, we know whether they're slow or fast progressors, who has salvageable tissue, and who we can go quickly and treat.
I think it's worth following up with your doctor, seeing your specialists, following their recommendation. Everyone is trying to do the best that they can in treating people and continuing to do that.